Hello everyone and welcome to Pharmaceuticals with new video of Pharmaceuticals. Today we will discuss new topic of Pharmaceuticals. But before that I just want to share my philosophy regarding this topic, my perspective towards this topic. Suppose there is an area or room in pharmaceuticals. We all know that there are many areas and rooms in pharmaceuticals, but here we take only one area. And there is nothing in this area, not even a single pin. But still there is something in this area, and this something has the power and ability to destroy anything in this area. Listen, here we are only talking about pharmaceuticals. So today our topic is this something. If I am not mistaken, you have understood this something. Yes, this something is nothing but air. And this air contains particles. It is called airborne particles. Friends, I am Nimesh Mistry and today we will discuss about airborne particles, types of particles, definition of particles and function of particles, because these particles play a very important role in pharmaceuticals, especially in classified areas, control area and clean area or clean room. If there is no control on these particles, then they are the main reason, they are the main cause for recurrence of incidents like contamination, cross-contamination, product degradation or product failure. There are many factors those affect the environment of pharmaceuticals, but the main three factors are temperature, humidity and particles. So out of this, today we will cover only particles. We will discuss about particles, types of particles, definition of particles and function of particles. Also see the differences of these particles. Types of particles. There are two types of particles take place in pharmaceuticals. Non-viable particles and viable particles. So first, non-viable particles. What is the definition of these non-viable particles? What is the function of non-viable particles? Non-viable particles are non-living particulate matter, means these particles do not contain living microorganism. These particles do not generate or divide into other non-viable particles. Non-viable particles include dust, mist, fogs, fumes, tiny waste, skin cell, clothing particles, etc. Now question is that why these non-viable particles are very important in pharmaceuticals? What is the role of these non-viable particles? And the answer of this question is that these non-viable particles do not act as spoiling agent, destroying agent or toxic agent, but these non-viable particles become vehicles and carriers of viable particles. It acts as transporting agent for viable particles. As per CGMP, non-viable particles to be measured during all critical process parameters or critical activities. Those are performed in grade A and grade B areas. It is also performed in grade C and grade D areas. We understand it with the help of an example. Here we are taking manufacturing process of eye drop as an example. This eye drop is manufactured in aseptic condition or aseptic area. Then non-viable particles should be measured during all filtration activities and filling activities, because all these activities are carried out in grade A surrounded by grade B area. Size of non-viable particles. The consideration and size of non-viable particles in aseptic environment or classified area, control area or clean room is from 0.5 micron to 5.0 micron. Sampling and testing of non-viable particles. These non-viable particles are sampled and tested using particle counter, and the limit and criteria of non-viable particles are given in this table. There is a slight difference in limit at test condition and in operation condition. As you are seeing in grade D area, when this area is at rest condition, then ISO 5 is to be complied with, but when it is in operation condition, then ISO 7 is to be complied with. And same for grade C area. When this area is at rest condition, then ISO 7 is to be complied with, but when it is in operation condition, then ISO 8 is to be complied with. So, we talk non-viable particles, definition of non-viable particles, and function of non-viable particles. Now, viable particles. What is the viable particles? What is the definition of viable particles? Viable particle means particle containing at least one living microorganism. This microorganism is able to germinate. It has the ability to multiply from 1 to 2 million in 7 hours and to more than 16 million in 8 hours. For example, E. coli. E. coli can divide every 20 minutes. It means in just 7 hours, one bacteria can generate 2 million bacteria. After 1 more hour, the number of bacteria will have risen to 16 million. This amount of microorganisms have the ability to destroy, have the ability to spoil any ingredients in pharmaceuticals. These microorganisms are the main cause of product failure. Failure in MLT, failure in BET, failure in sterility. These microorganisms include yeast, bacteria, mold, fungus, spores, etc. Next, size of viable particles. The size and consideration of these microorganisms, viable particles, ranges from 0.2 micron to 30 micron. Maximum percentage of these microorganisms are unable to move from one place to another place, and for moving, they require vehicle and carrier. And this role is played by non-viable particles. Here you can see many microbes. And some of them, like Salmonella typhi, Helicobacter pylori, they have cilia and flagella respectively. And because of cilia and flagella, they are able to move in medium. But maximum microbes like Staphylococcus, Streptococcus, Clostridium and many others, they do not have this cilia and flagella. And because of that, they are unable to move from one place to another place, and for moving they need non-viable particles. Here you can also see two non-viable particles, and many microbes or microorganisms are attached to the surface of these non-viable particles, and they move from one place to another place with the help of air movement, material movement, man movement and equipment movement. How to collect a sample for viable particles, or what is the sampling method to be used for viable particles? There are two main methods are widely used for viable particles. First, active sampling, and it is done with the help of air sampler. Then passive sampling. It is also called settle plate method, and it is done with the help of batteries. Now, limit and criteria of viable particles are given in this table. Now, if you want to prevent your product from contamination, then these viable particles must be these viable particles must be under control and within limits, because if any one viable particle is mixed and introduced into the product, then this one viable particle is enough to spoil the entire product. And if product gets contaminated and is to send to the market, it can cause serious health problem to the patient. And that's why, and therefore, it is mandatory to consider and control non-viable particles and viable particles in pharmaceutical. So friends, today we have got knowledge about non-viable particles and viable particles, their definitions, their functions and their differences. This video is very helpful for those who are working in sterile product manufacturing plant. Either it is terminal sterilization or aseptic processing. Thank you for watching this video, and we'll meet again with new topic of pharma. Thank you.